Getting out of the Marines as in infantry, it left me really starting over again. I ended up seeking power and pleasure in life, leading me to extensive homelessness, drug addiction, long-term incarceration, life of crime, and above all, hopelessness. I could never have told my story if there were no ears that wanted to listen.
It's about reaching this deep place of being able to assist another person to become healthy, to be re-engaged in their life, to live their values and their vision. It reconnects individuals with why they want to live, what they want this for.
The skill sets that you will learn moving through this pathway will help you achieve what you have in mind for your optimal health and wellness. The whole health pathway is tuning into our veterans, exploring their concerns, preferences, needs. And moving through this pathway will help you achieve what you have in mind for your optimal health and wellness.
So I think the orientation is an important piece to help gain a full understanding to what these things are, how they might help them on their path to well-being.
It has you right here in the center. Not the doctor, not the VA, you right here. What I love about this class is that it does really support veterans to take a complete look at their life, to look at every aspect of life, every aspect of health and well-being. We find people getting really excited about that. They feel that sense of empowerment, they feel that sense of agency that we want them to feel, and then they're able to go out and make changes for themselves that they want to make. And for me, that's the essence of the whole health conversation. You know, it's the veteran in the driver's seat.
I've always struggled with my weight. I'm a yo-yo. And I go up and down. I'll lose 20 pounds, I'll gain 30 pounds. A whole health facilitating group is a group of veterans will get together with a facilitator and you talk about this program from the perspective of the veteran. That acceptance that you just
right, that acceptance, right.
Yeah, you're going to find that immediate acceptance.
Keyword, acceptance.
That's it, yeah.
Yeah.
Asking the veteran what's important to them now is the first question we propose to them and that we want them to think about. And I tried to give them some time to think about that because that's a big question. And oftentimes they've never thought about it before. What's important to you in your life?
Well, what I wanted my health for then, after living such a reckless and destructive life, I wanted to be able to give back. So I wanted my health to be able to make the latter part of my health a part of the solution and not the problem. What I enjoy the most for being a whole health facilitator is seeing the growth and the confidence of other veterans when they take that class. They can find where they're at and start to believe where they want to go and start to plot out a course, so, you know, a personal health plan for their provider, and they can go in there empowered and take charge of their health care and say, hey, this is where I'm at and this is where I want to go. And can we work together to get here?
Every VA has veterans that are willing and able to teach, and they listen, and they're able to relate, and they're able to identify with the struggles that their fellow veterans have. And so anywhere in the country, I don't care where they are, they're able to replicate what we're doing here.
The first telehealth group that we held, they just bonded so strongly that they actually wanted to physically meet all together in one spot. So it was very heartwarming.
Telehealth is where you're actually looking at the other groups from a distance on TV monitors. And you have the speaker, you can mute it, then you can cut in, you can add what you would like to the group.
So the beauty of whole health in my mind is that we do engage so many people in the healthcare system. This isn't just about clinicians anymore. We really look at how we can have our veterans participate. And the interesting thing to me is that there are so many patients that really respond to their fellow veterans. And, you know, I as a clinician can sit and talk with a patient, but the real trust and the real relationship sometimes is veteran to veteran. So now we have veterans that are coming forward saying, yeah, you know, I believe in this and I want to give back. So we're able to train them. The Office of Patient-Centered Care and Cultural Transformation has a training course, for example, for whole health partners. And in that training, they really learn how to engage with other veterans, talk about personalized health inventories and goal setting. And I have to tell you, the feedback from a few of our veterans that have done that training is really pretty awesome.
The biggest reason I want to lose weight and keep it off and stay healthy is so that I can help my family and so that I can do things and interact with my family, interact with my community. And when you are healthy, when you do feel good about yourself, you're confident.
Alex Stallworth and Marvin Everest embody the whole health message because that's all about their journey, and their personal story basically says it all. There's no MD or RN behind their name, but they bring to the table so much knowledge and wisdom.
When I walked up to my house the first time, my first house that I've ever owned, it was unbelievable. It's like living a dream, you know, because I never thought I would attain a home. So, well, this neighborhood holds a lot of significance to me because this is one of the first places I was able to come back and get reintegrated into the community and use some of the tools and techniques that the VA's programs have taught me to be productive and constructive in my life. You know, it put me in the driver's seat and empowered me to take control of my new beginning, my new life. The VA can help you, they will help you, and they want to help you.